Let's learn how to take extraoral and intraoral photographs for orthodontic patients. The armamentarium required for photography is cheek and lip retractor. There are various types of retractors available in the market. Like this one is a double-sided retractor which has one bigger arm and the other short arm, which can be used in periodontic patients or patients with limited mouth opening. I personally prefer this one, though we have different sizes and different purpose retractors available in the market. Another thing that would be required for the occlusal view are the mirrors. So you have stainless steel mirrors which can be autoclaved, or you can also use glass mirrors, but they need to be sterilized. These cannot be sterilized in autoclave, so they need chemical sterilization. Apart from this, you would require a good quality camera. So I prefer using a DSLR camera with ring flash for intraoral views, but students can use their phones also for photography. For extraoral photographs, make the patient stand on a clear, uncrowded background. The color of the background can vary from pre-treatment, mid-treatment and post-treatment photographs according to any of the American Association of Orthodontic standards or IBO standards. The photograph should be taken in a standardized condition from a standardized distance and in good lighting conditions where you do not see any shadows. If needed, you can use extra lights to illuminate the face of the patient. The photograph should be taken in a portrait mode. The first photograph, which is frontal at rest, should be taken in natural head position. The patient should look directly towards the camera and hair should be neatly tied behind the ear so that Frankfurt horizontal plane is visible. The photographs should be taken at rest position so that if there is any lip incompetency, it should be captured efficiently in the photograph. It is important to interact with the patient and make the patient comfortable before taking the smiling photographs, as the patient might be reluctant in smiling at the first appointment. It is important to capture the essential components of smile. For example, in this patient, we can see a gummy smile. The next photograph is frontal with smile, in which the patient should be told to smile as if in a social smile and not laugh or not keep the lips closed. The incisors and smile should be fully visible. Keep in mind to take the photographs in portrait mode and not from above or below. Keep the camera aligned with the head of the patient. For the profile view, the patient's head should be in natural head position and hair should be behind the ear. The patient should look straight as if he is looking in the mirror. For the 3/4 view, tell the patient to turn at 45 degrees. The other side of the cheekbone should be clearly visible in a 45-degree view. The next view is 3/4 with smile. This image helps us assess the inclination of incisors. For taking the intraoral photograph, the attendant should stand behind the patient. The chair has to be reclined at 45 degrees. For first photograph, which is the frontal view, the retractors have to be placed and the lip has to be retracted so that it forms a curtain. You should not pull the retractor backwards, but it has to be pulled out so that it forms a curtain while taking the intraoral view. When you are taking the buccal view, you have to tell the patient to turn on the other side and then retract the cheek retractor so that you can see the molar relationship completely. It is important to stabilize the position of the head and place the camera perpendicular to the premolars so that the right molar relationship can be captured. Common mistake that students do is they take the photographs from an anterior place, so the right molar relationship cannot be appreciated in the photographs. A class 1 molar relationship can look end-on or class 3 if the view is taken more anteriorly or posteriorly. When you are taking the photograph of the other side of the buccal view, you should turn the camera in such a way that you don't see the shadows and the flash or the light focuses more towards the areas where shadows are forming. For the maxillary occlusal view, place the retractors in the center in such a way that the nostrils are not visible in the occlusal view. You should tell the patient to raise the chin a little and open the mouth wide so that the last molar erupted can also be captured. For the occlusal views, you should use the small size of the retractors. Place them in the center. Tell the patient to open the mouth wide and place the tongue on the palate. Now you position your mirror in such a way and tell the patient to open the mouth wide. Open wide, still wide, like this. If you observe fogging, you should tell the patient to either stop your breathing for 10 seconds or breathe through your nose. When you are capturing the mandibular view, the lingual side of lower incisors should be visible.